Because people can think of having more beds as, yeah, a good thing. We also think, of course, of having more hospitals is a good thing. Um, so, do you think the repeal leads to better access to care by, meaning that having more hospitals, but smaller hospitals on average, is that a good thing or a bad thing?
Yeah, I think that's a really important question. And in rural areas in particular, which is sort of what a lot of policymakers worry about, because that's, like I mentioned, that's where access to care problems are particularly acute. In rural areas, I think the increase in hospitals, but as you say, their small size, is generally beneficial. Because what a
Mhm.
lot of rural areas and rural residents face is really long driving times to any room.
Mm.
And so, if you have, an emergency, if you need urgent care of some kind, you really face a long delay in getting that problem looked at. And the increase in the number of hospitals, though they might be small in rural areas, reduces driving times, or would be expected to reduce driving times for a lot of rural residents, which would give them access to some care. Maybe not the most sophisticated care. A lot of these hospitals are not going to have, the top level trauma units, but enough to stabilize a patient and maybe transfer them to a more sophisticated care setting.